neuropsych testing can be very beneficial for a number of different, well, it can serve a number of different purposes. So pre and post treatment. So looking at, how is cognition before a treatment happens and how is it afterward? How have things changed? Doing that sort of pre-treatment assessment of cognition can sometimes also be helpful for predicting declines that might be secondary to treatment, whether it's a neurosurgical intervention or chemotherapy, radiation, you name it. That's one of the ways that neuropsych testing could be helpful. Predicting outcomes, how successful is surgery, for example, likely to be? Is there likely to be a significant improvement in quality of life, as an example? These are things that neuropsych testing can be a part of to help make these kind of treatment decisions. Diagnosing psychological conditions, whether they've been missed or never diagnosed, or whether they are new, or assessing and providing some kind of support and assessment and feedback regarding interventions. What can we do to keep somebody safe in the home if they are, if they have behavioral dysregulation or something along those lines. So these are all, within our purview of things to comment on and to make recommendations for. And then a big part of it, and I think often the nature of the referrals that we get in the context of folks who have brain tumor or have a history of brain tumor is, well, can we distinguish the effects of the brain tumor from other factors, right? So is there an underlying Alzheimer's disease? Is there some other condition that might be contributing to cognitive problems? Or are there other modifiable or potentially modifiable factors that are contributing to cognitive problems? Those might be treatment effects. We know chemo brain is a very real phenomenon. It's a very real thing. And one of the things that we might be asked to do is to say, hey, are we seeing somebody whose memory problems are because of chemo brain, or is there potentially something else going on? It might be fatigue or pain or emotional distress or other medical conditions that have cognitive impacts. And all of those pieces of data are helpful or useful for treatment planning. And I think that is probably the best overview I can give you. Hopefully that wasn't excessively long, but I'd love to just anybody who may have any kind of questions or anything, I'd be happy to share anything that I can.
Got one. Or I have related cognitive issues. You talked a little bit about age.
Mm-hmm.
How does that actually, 'cause if you look at our faces, most of us are older than elderly. No, we're not old elderly, but
You talk about yourself, Tom.